Good morning, everybody. And again, thank you to the frontline essential employees out there doing their job day in, day out. As always, I want to thank you, all the hospital staff, administrators, everyone that's doing a great job keeping our community moving forward. Thank you. But unfortunately, we had 2 more residents pass away last night, which brings our total up to 51. A man in his 70s and a woman in her 60s, both with underlying health issues. And my condolences, my heart, and my prayers go out to the families. And not just to them two, but to the 49. And I like to remind everybody that these are difficult times. And most importantly, think about this: losing somebody and you can't visit them, you can barely have a wake or funeral services, and a lot of friends can't say goodbye. It's a tough time for everybody. So keep that in mind as Dr. Whalen and I continue to say social distance, clean your hands, cough into your arm, and do the right things. And we can stop this, and we can move forward, but we can only move forward if everyone wants to be part of the solution, not part of the problem. And that's what I keep hammering on: be part of the solution. To the Monday quarterbacks every day on Facebook and out on social media complaining, come up with a solution. Give us ideas. We don't have all the answers. I'm not going to sit here and tell you I know every answer. I don't. But I rely on people to my left, to my right, to the Business Advisory Council, to the legislature, to talk to everyone, to figure out things. And we can do this together, working together, taking care of one another, and being the good New Yorkers that we are. But it's not going to work when people sit there and don't want to do social distancing, don't believe in what's going on, don't think this world, everyone's overreacting, everyone wants to keep us shut indoors. We don't. I can assure you, when I talk to business owners 7 days a week, around the clock, because they're scared. They don't know if they can reopen. They put their sweat and equity into these restaurants, into these businesses that they own. And I have to, and they're like, hey, county executive, thank you for taking the time and listening to me. I have to listen to them. They're the backbone of our community. And if you want to reopen up people, I hope you know it's not going to be the big box stores. It's not going to be Target and Walmart. It's going to be the stores on the street corner that are the fabric of our community, that have been the backbone of our community since the beginning. They're the ones, not these other ones. Shop local, go to local shops on your street. And the bigger ones, look, they make all the profit. When everyone complains, they make the profits. The workers don't. Doesn't benefit. It's cheaper to go there. I get it. Go to the local restaurants. Go to the local stores in your neighborhood. Support your people that are your neighbors. That's how we're going to get through this, but doing it smartly and wisely. So, good news. As of today, 1,236 positive cases, up 12 from yesterday, which is a good trend, because I know I always have this conversation with Dr. Whalen and we get nervous. Sometimes on weekends the numbers slow up and then it seems to hit hard on a Tuesday or a Wednesday. So that was good news. 1,107 people under mandatory quarantine, which is up 6, and 4 people under precautionary, which stays the same, which is good. Our Shaker Place stays the same. 48 residents who have tested positive, including 2 who have recovered. 15 employees have tested positive and remain out, while 9 others have fully recovered and returned to work, which is great news. Also, we have 2,722 people that have completed quarantine, which is up 133 from yesterday, and we have 662 tested positive for the virus and have recovered, up 46 from yesterday. Another great thing, there are now 33 people hospitalized with a hospitalization rate of 2.66. We have 8 people currently in our ICU. That's up 1 from yesterday. And listen, with more testing and what we're doing to open up, part of the 7-step plan from the governor, these are things that we have to do. And we're getting there, working together in a partnership, working with Rensselaer County and Steve McLaughlin, working with Tony Jaginski and Schenectady, working with Saratoga. We're working with Columbia and Greene and everyone else. There's a regional approach that we have to take to this. And it's going to working together, getting more testing out into the community and finding out who's it affecting more and how we can open up. And we'll get there. We're getting there. But like I said, Rite Aid, or actually, let me go to the mobile testing. We've tested 835 people so far at our mobile testing, and which has been great. Rite Aid has tested over 500 people in the last 12 days, which is great. And the urgent care in Gilliland, which is testing people on a smaller number, but everything helps. Everything helps. Now, the 835 people that tested at our mobile sites, 107 were positive. We can't do this without standing together as one. And I said, everyone that's home watching this or listening to this, please, please, it's a marathon. It's not a sprint. Take a step back, take a deep breath. There's a new reality we're in. There's a new norm, and we'll get through this together working. A couple of the other things I do want to talk about, the regional testing, and actually I reached out to Dr. McKenna this morning before I came on because out of the 7 steps, currently, like I said, we're meeting 4, and the 2 that we're missing is the 14-day decline in hospitalization, and I'm not going to throw Dr. Willen on this, on the spot. But one of the things I was trying to reach out to him is that Albany Men's a regional hospital. It's just not in our capital district. It's regional. So there's people outside our RDC that they want to come in and look at this. It's not going to work if them numbers are counted against us, and we got to figure that out. And that was one of the questions that I had for Dr. McKenna, because how many people are outside our region that are coming to Albany Men? Because that's going to affect our number. So we can address that. That will give us 5 out of the 7 steps. And we're going to meet number 6, which is the 30 per 1,000 residents tested monthly. And the last one, no one can meet. So I am so confident with working with the other counties and Columbia and everyone else that we can open up in a timely manner. And then, after May 15th, as the governor rolled out, we've been working on this since day one. We've been working on this for over 50 days. I've been doing this with my advisory council, and we sent a letter to the governor's office this morning to talk about our approach and how we're moving forward. So I'm very confident, as long as our numbers, and Dr. Willen will talk more about this, as long as our numbers stay down, and our hospitalization rate and everything else, we're going to get through this. But we have to do it together. Dr. Willen.
Thank you, County Executive McCoy. So I too extend heartfelt sympathies to the families that have lost loved ones. We're following along very closely with the State Health Department on the investigations surrounding nursing homes in Albany County, and making sure that when cases are identified that we do what's needed to prevent spread. And this entails doing additional testing to test workers and nursing home residents that are asymptomatic. As we've said all along, identifying cases is the best way to control them. Once you know someone is positive, you can mitigate further risk through either isolation or cohorting individuals so that they do not spread the disease. It's more important than ever that we're meticulous with this, as we have been from day one, to stem the spread within the nursing homes. Overall, though, our numbers are steady. And, as we discussed yesterday, we in Albany County, because we have been pretty good in terms of compliance with social distancing, social isolation, making sure people are staying home and making sure people are wearing masks when out in the community. We have done a pretty good job flattening our curve, and we have not seen issues with surge capacity in our hospitals that were similar to what we saw downstate. This is good news, and it causes us to start to have these important discussions on what that means going forward and what we do to reopen things. One thing that I want to highlight, and there is no plan for reopening in any scenario across the country that will not involve the continued importance of hand hygiene, of keeping social distance, in New York State of wearing masks when you are out and about. So it is very important that people know they need to continue to embrace and work on these control measures. They're essential. I know there are those that are uncomfortable wearing masks when they're out and about, when they might be closer than 6 feet to others. People give consideration to individual rights. I hear that argument. But you know, the analogy that I would draw is that I, as an individual, have a right to move my arm wherever I want to move it. But if my arm or my fist makes contact with your face, then I have lost my individual right. This is what we're talking about. These germs that are out and about. When you wear your mask, you are protecting others. You may be an asymptomatic transmitter. You don't know. We are learning more about this disease every single day, and in the meantime, it is essential for people when they're out and about to wear masks so that they're protecting others. That is a right of others to have you wear a mask when you're in their presence. So that is going to be essential in any of our plans going forward until we can get to a stage where we have more knowledge and more comfort in terms of immunity, in terms of a vaccine, et cetera. It is not going to go back to what we previously considered as normal for a long time. So these strategies are as important as they have ever been and will continue to be important in any part of a reopening going forward.
Thank you, Dr. Whalen, as always, in everything that you're doing for us here during this uneasy times we're going through. To you and your staff, thank you. And you know, we have to continue to be there for one another. And someone that's been in our community for a long time doing stuff for us, the Community Loan Fund of the Capital Region, and I have the executive director here to talk about some of the COVID-19 small business community grant programs that's awarding small businesses up to $20,000 and to help them stay afloat during this crisis. So who better than to talk about it but Linda? If you want to explain the program, that'd be great.
Thank you very much, County Executive McCoy. You were right on with your comments about the importance of supporting small businesses. They are the root of our neighborhoods and of our communities. And I do not know of a single small business that has not been negatively impacted by this COVID-19 crisis. The COVID-19 Small Business Continuity Grant Program is intended for small businesses that need that little bit extra. They need some funding to help them to survive, to help them pivot their business, or to help them cover the gap while they're waiting for some of the federal funding that is out there and available. The grants are up to $20,000. Our website is posted, so you can apply through our website. The application process is very simple. We are defining small businesses as 50 or fewer employees, and we are interested in businesses that have experienced at least a 10 to 25% decline in revenue due to COVID-19. There's a real need for this grant program because small businesses with round one of the federal funding, a lot of them weren't able to take advantage of that. A lot of these small businesses may borrow money through organizations like the Community Loan Fund or other certified community development financial institutions, but are not borrowers of banks. And if they were not a borrower with a bank, they weren't able to process applications for some of this federal money, in particular the Payroll Protection Plan money, known as PPP. In round two, that's getting a little bit better, but there are still all sorts of problems for these small businesses. And sometimes they have applications in and don't know if they have been awarded. They don't know if they're going to be awarded or when the funds are going to be received. So with all of these challenges going on, grant funds are really needed. If you can imagine you're in financial crisis and someone says to you, here, take out a loan, that's not the answer you need. You don't need to incur more debt when your cash flow is so heavily strained. And if you don't mind, I wanted to give a couple of examples of small businesses we're helping, and I think
No, please do.
most small businesses will be able to relate to some of these examples. Kima's Creations is a minority woman-owned business, and she is in downtown Albany at 255 Orange Street. She is a seamstress and an embroiderer and makes beautiful bags, handbags, and larger bags and clothing. As COVID-19 hit, she very quickly pivoted her business, and I actually wear one of her masks that has refillable, replaceable filters in them, so it's wonderful. And she has made over 1,200 masks. As of yesterday, she reached the 1,200 mark in making masks by herself. So what she is looking for in the grant application is to purchase a piece of equipment that will cut the fabric faster. She has hired 2 additional minority women to help her with the sewing process, but she can't find that kind of funding anywhere else, and that is what's going to help sustain her business and also help the community with the making of the masks. So it's a great example of someone who was able to pivot, continue to use their strengths and their skills, but needs a little bit of extra help because she doesn't have the equipment that she needs for cutting the fabric. So that's one example.
Nice.
Another example, I think a lot of the listeners know Bead Lodge and Company, downtown Albany. This is a community-based business that has been around for over 150 years, and they are a family-owned business. So the brother and sister, Mark and Sharon, have had to close. They are continuing to pay their employees, which is wonderful. They're able to do that, and they are a retail shop, and they cannot have people coming in, so they are closed but paying their employees. One of the things that they sell in the store is uniforms for school-age students. And what they're needing is to purchase the inventory, embroider the uniforms so that they are ready for kids when they go back to school in September. Hopefully, kids are back to school in September. So they need some grant financing because they're using their savings to pay their employees and cover their rent and those other types of operating expenses. So we're looking forward to working with them. Another example is JAFJR Construction Services. He is a minority-owned business, and as a minority-owned business contractor, he is in high demand for any state contracts because they require a 30% minority or women-owned business contractor in doing the work. In 2019, the owner, Rocky Mann, realized that he was growing too fast, and he was branching out and doing work that he was new to him, and he realized he needed to pull back, hone in on what he was very good at, and he took some time to refocus his business at the end of 2019. 2020, ready to go again. Along comes COVID-19, so he has no staff, but now that he has relaunched his business, he's ready to hire employees, and he's ready to take on a job. He has a contract in hand. He doesn't have employees, and he doesn't have an office administrator, and doesn't have the cash flow to support them. So he is looking for some assistance in that regard. And I'll give one more example. In downtown Albany, John Bowers owns Spa Halcyon, which provides different types of massage. Wonderful, wonderful place to visit if you haven't gone, but of course he cannot be opened. And with massage, you are touching, you are face-to-face, you are hands-on, so as you can imagine, it's going to be a long time before he can reopen. He's anticipating an additional 6 months before he is able to open. And unfortunately for him, he has an underlying health concern, so he's thinking that plays into the possible 6 months of waiting to open, but he still has to pay rent in his location. And what he is really going to need will be grant funds when he is ready to reopen, because supply chain distribution will be very different for him, as well as a lot of other challenges of making sure that his clients and he are safe when they are able to come in and receive massage treatments. So not only do we need grant funds now, we also are going to need them when the economy opens, in these retail shops that are going through stumbling blocks and feeling a bit broken right now. As they reopen, are going to need a lot of support and funding.
Absolutely. And Linda, thank you for your leadership in the community and to the Community Loan Fund, because we had a lot of questions on that when the first stimulus package came out, or the last one. A lot of small companies weren't able to qualify for loans or didn't know how to fill out the paperwork. It's something they never navigated before, so thank you for what you're doing in the community, because we got to be there for everyone, so which is good. Some of the other things, helping our business get back to work is so important, but also I'd like to share some good news with you. Crossgates Mall will be hosting a food drive to benefit veterans this Saturday, 10 to 2. You can drive into the parking lot at Macy's by Dick's Sporting Goods, follow the signs to the collection area. All you have to do is pop your trunk. You don't even have to get out of the car. They don't want you to get out of the car. Pop your trunk. They'll come over, they'll take the food out, and they'll shut your trunk, and if you can't open up your trunk, they'll have you hand it through the windows, but they'd rather have you do it through the trunk, obviously social distancing and doing the right things. They're looking for mac and cheese, peanut butter, rice, oatmeal, and cleaning products, paper towels, and obviously the one everyone seems to enjoy here in the Capital Region, toilet paper. So they're looking for that. If you can donate, that'd be great. A complete list can be found at shop@crossgates.com. You can link onto that, and then you can see what's going on. Also, I want to thank Legislator Carolyn McLaughlin. We've been working in certain areas of the city, and unfortunately, what happens, people talk about the homeless population and different things. With businesses closed, there's no place for these people to go do their business. So the unfortunate reality is we put porta johns out through certain areas in the city to offset that. And it was a question from our legislator, Carol McLaughlin, and other community people, and us looking at it and working with different agencies and Department of Health, that we said we had to address this issue. So there are porta johns now strategically throughout the city of Albany in different areas to address them issues. So there's 6 of them. So you may see them. I'm not going to put a picture up of them. I'm not going to tell you the locations, but we said put them out throughout the city for them reasons. Please, as always, mental health is so important, so important. You're going to change, and you're changing without realizing it, and you're getting a little bit crankier because you've been home, and I get it. 7 days a week, 8 a.m. to 8 p.m. You can call our number, 518-269-6634. And please, as always, for our 24-hour sexual assault hotline number is area code 518-447-7716. As always, the 211 number in New York State hotline. And thank you to everyone for being part of the solution, not part of the problem. Thank you.